classification headache, I already mentioned. We will go through this migraine, tension, cluster headache, all this medication overuse headache. But when we talk about secondary headache, indicators of serious secondary headache are mainly 4. These you have to remember. One is thunderclap headache which is associated with neurological deficit, headache which is associated with systemic features, and sudden onset headache started after the age of 50. So they don't have any history of headache. Now, these are the 3 or 4 groups. Now, thunderclap headache, it is that sudden onset severe headache which reaches the maximum intensity within 5 minutes. So I will spend some time on this thunderclap headache because it is the most serious type of headache we encounter. So subarachnoid hemorrhage is responsible for, say, 20 to 25% of this thunderclap headache. If you encounter a patient with thunderclap headache, you have to send this patient for neuroimaging, like CT scan. Now, even if the CT scan is negative and your suspicion of subarachnoid hemorrhage is strong, they have to undergo a lumbar puncture to see whether there is any xanthochromia or red blood cell in the spinal fluid. Only then you can say that, no, it is not a thunderclap headache from subarachnoid hemorrhage or other bleeding conditions like intracerebral bleed or dissection of the aneurysm or these kind of conditions which can give. But interestingly, we have seen that certain conditions like migraine, like cough, like sexual intercourse, they can also can cause this thunderclap headache. Now, there is a new entity which is now a very in subject or a point of discussion is the primary headache secondary to sexual activity. Now, sometimes the thunderclap headache associated with this, they only is associated with the sexual activity, and with the increase in sexual excitement, the pain intensity also reaches the maximum, and there has to be at least 2 episodes to diagnose that. But if a patient, even you suspect strongly that it is, because this is falling under primary headache, that headache associated with sexual intercourse or sexual activity. So this category, if it is a primary headache, but that needs investigation if it is present like a thunderclap headache. Only then you can say that definitely, and they, as I have said, the first episode of thunderclap headache associated with sexual activity needs to be investigated by CT scan, and if you think that it could be subarachnoid hemorrhage, if you have to do an LP, and then only you can say it is no, okay, it is something more benign. Now, if the headache is progressing over days or weeks, but there is associated neurological deficit, or patient is having some kind of systemic features like fever, like rashes, like neck rigidity, you know that this is not something very simple. You have to do something about it, and you have to get in touch with the neurologist, or you can arrange some investigation if you have that confidence. And that sudden onset headache in patient over the age of 50, particularly if there is temporal tenderness, you have to send an ESR, because temporal artery biopsy to diagnose this condition, giant cell arteritis, is not, so we are not doing it anymore because there is a skip lesion. As there is a skip lesion, you can miss the lesion. If you miss the lesion, you cannot say that it is not a giant cell arteritis. So very high ESR in the range of 60, 70, 80. If you see with a patient, say 55 plus patient with temporal pain and there is prominent temporal arteries or a throbbing pain there, better you start them on steroid, because if you are not starting them on steroid, they can lose their vision. And steroid in a very high dose, in the dose of 60 milligram, you can rapidly taper it off as soon as the ESR is coming down, but you have to continue with the steroid for some time. Because once the vision got affected, it's lost completely. In those patients, you can argue that why will I give steroid high dose in these patients? Only to save the other eye. But that eye's vision will never ever come back.